Your dog just had a tooth removed. But what should you feed during recovery? Some foods help the mouth heal faster, while others can cause pain or delay healing. Like this video and subscribe for more helpful dog care tips. Let's get started. Ground chicken. Ground chicken is one of the best first meals for dogs recovering from dental extractions. Because it's finely ground, dogs can swallow it with very little chewing, helping protect sore gums and fresh extraction sites from unnecessary pressure. Chicken is naturally rich in complete protein, providing the essential amino acids needed to repair damaged tissue and support faster healing. If your dog is already used to a raw diet, choose fresh human-grade chicken that's been handled safely and avoid feeding large chunks that encourage chewing. Serving it at room temperature instead of straight from the refrigerator can make it more appealing, especially if your dog has a reduced appetite after anesthesia. However, if your dog has a known chicken allergy or sensitivity, it's best to choose another protein source until recovery is complete. Salmon. Salmon brings something different to your dog's recovery than most other protein sources. It's naturally rich in omega-3 fatty acids, especially EPA and DHA, which help support the body's normal inflammatory response and promote healthy skin and tissue repair after dental surgery. For the safest option, choose cooked salmon or properly frozen, sushi-grade salmon, intended for raw consumption to reduce the risk of parasites. Always remove every bone before serving, and offer it in small, flaky pieces that are easy to eat. Because salmon is higher in fat than lean meats, it's best served in moderate portions, making it an excellent addition to a recovery diet rather than the main meal every day. Ground beef. Ground beef is an excellent choice when your dog needs extra nourishment during recovery from a dental extraction. Unlike leaner proteins, beef naturally provides more iron, zinc, and vitamin B12, nutrients that help support red blood cell production, immune function, and the body's healing process. Choose finely ground beef with a moderate fat content, such as 90% lean, to provide energy without making the meal overly rich. For dogs eating a raw diet, use fresh, high-quality beef that's been handled safely and serve finely ground to avoid unnecessary chewing. If your dog has a sensitive stomach after anesthesia, begin with a small portion and gradually increase the amount as their appetite and digestion return to normal. Bone broth. Sometimes the best recovery food isn't a food at all. Bone broth is an excellent way to keep your dog hydrated when chewing feels uncomfortable and drinking less than usual. Its rich aroma often encourages dogs with a poor appetite to start eating again, especially during the first few days after surgery. You can pour a small amount over ground meat to soften the meal and make it more flavorful without adding extra chewing effort. Choose a plain bone broth made specifically for dogs, or prepare your own without onions, garlic, excessive salt, or added seasonings, as these ingredients can be harmful. Served lukewarm rather than hot, bone broth becomes a gentle, comforting addition that helps make recovery meals more inviting. Complete ground raw mix. A complete ground raw mix can simplify feeding while your dog's mouth is healing, because everything is already finely ground into one balanced meal. Unlike feeding a single ingredient, these recipes typically combine muscle meat, organs, and finely ground bone in appropriate proportions, providing a broader range of nutrients in every bite. The smooth texture allows your dog to eat with minimal jaw pressure, making mealtime more comfortable during the early recovery period. Choose a commercially prepared formula that meets recognized nutritional standards or a properly formulated homemade recipe developed with veterinary nutrition guidance. Serve it chilled or slightly warmed to enhance the aroma, and avoid adding chunky toppings that could make chewing more difficult until your veterinarian confirms the extraction site has healed. Eggs. Eggs are one of the easiest foods for a recovering dog to enjoy without putting extra stress on a healing mouth. They contain highly digestible protein, along with essential amino acids that provide the building blocks the body needs to repair damaged tissues. Eggs also supply important nutrients like choline, selenium, and vitamin B12, which support normal cell function and overall recovery. For the safest option, serve them fully cooked as scrambled or softly boiled without butter, oil, salt, or seasonings. Mash the eggs into a smooth consistency or mix them with your dog's regular soft meal to create a nutrient-rich dish that's gentle to eat while the extraction site continues to heal. Pumpkin puree. Pumpkin puree is a gentle option when your dog's digestive system needs just as much care as their mouth. Made from plain cooked pumpkin with no sugar or spices, it has a naturally smooth texture that can be licked up comfortably without putting pressure on tender gums. It's rich in soluble fiber, which helps support healthy digestion and can be especially useful if medications or anesthesia have temporarily upset your dog's stomach. Pumpkin also provides vitamin A and other beneficial antioxidants that contribute to overall health during recovery. Serve a small spoonful on its own or mix it into your dog's regular soft meal, but avoid pumpkin pie filling, which often contains added sugar and spices that are not safe for dogs. Goat milk. Goat milk can be a soothing addition to your dog's recovery diet, especially when they're reluctant to eat or drink after a dental extraction. Its naturally mild flavor often encourages dogs to stay hydrated, while the liquid consistency requires almost no effort from a sore mouth. It also provides protein, calcium, and beneficial probiotics that may help support normal digestive health during recovery, particularly if your dog is taking antibiotics. Choose plain pasteurized goat milk or a goat milk product specifically made for pets, with no added sugar, flavors, or sweeteners. Offer it in small amounts as a supplement rather than a meal replacement, and discontinue use if your dog develops digestive upset, as not every dog tolerates dairy equally well. Raw meaty bones. Raw meaty bones are normally a favorite for many dogs, but they should be put on hold after a dental extraction. Even though raw bones are softer than cooked ones, they still require powerful chewing forces that can place unnecessary pressure on fresh surgical sites. Biting down too soon may cause pain, reopen healing tissue, or disturb the blood clot protecting the extraction socket, delaying recovery and increasing the risk of complications. It's best to wait until your veterinarian confirms the mouth has healed before bringing raw meaty bones back into your dog's routine. Once they're safe to offer again, reintroduce them gradually and supervise every chewing session to ensure your dog is comfortable and chewing normally. Hard kibble. Hard kibble may be convenient, but it's rarely the right choice immediately after a tooth extraction. Its dry, crunchy texture forces dogs to bite down repeatedly, which can irritate sensitive gums and make every mouthful uncomfortable. Small pieces of kibble may also become trapped around the extraction site, where food debris can interfere with healing if it cleared away naturally. If kibble is your dog's regular diet, try soaking it in warm water or a plain, dog-safe bone broth until it becomes soft enough to mash easily with a fork. Once your veterinarian confirms the surgical area has healed, you can gradually reduce the soaking time and transition back to your dog's normal crunchy meals. Bully sticks and hard chews. Bully sticks, yak chews, antlers, and other long-lasting chews should stay off the menu while your dog's mouth is recovering. These treats are designed to keep dogs chewing for extended periods, exactly the opposite of what a healing extraction site needs. The constant pressure and repeated jaw movement can irritate delicate tissue, trigger bleeding, or slow the formation of healthy new gum tissue. Many dogs also become so focused on chewing that they ignore discomfort, increasing the chance of accidental injury before the mouth has fully healed. Save these favorite rewards until your veterinarian says it's safe, then reintroduce them gradually while watching for any signs of tenderness or reluctance to chew. Thanks for watching. We hope this helps your dog recover comfortably and safely. If you found this video useful, please like, subscribe, and we'll see you in the next one.